On a day that is about hearts and love, some people may be struggling with reconnecting with others due to COVID-19 and the impact that it's had on emotional and mental wellness. So we want to take this time right now to kind of get away from the talk about chocolate and flowers and talk about how important it is to take care of your mental wellness. For today's To Your Well-Being, we are joined by Dr. David Gutterman, licensed clinical psychologist and clinical director of LeBauer Behavioral Medicine, and licensed clinical psychologist Dr. Jenna Mendelsohn. All right, so first and foremost, Dr. Mendelsohn, let's just kind of talk about how important is it really to take care of your mental wellness? Because I think sometimes we just think, I'll just be fine.
It's crucially important to take care of our mental wellness on a physiological level. Emotions are physical experiences and they have a real impact on our physical health as well. For example, there's a 2016 study that found that 30% of heart attacks are directly attributable to psychosocial factors like stress. So it's a real physical experience to be stressed out. Plus, it doesn't feel good emotionally. So even just for that reason, it's important to take care of our mental wellness.
I think, when something hurts, like physically hurts, we're more acute to that. And we just think, oh, we just need to, just figure it out and move on to the next thing. So that is a really great reminder. Dr. Gutterman, what impact has living with COVID-19 now for 2 years had on emotional wellness and people's ability to positively connect with others? What are you seeing?
The impact, Tanya, has been significant. And in fact, I think it's far beyond what any of us really anticipated. First of all, we didn't anticipate this would be going on for 2 years, but we've seen huge spikes in reported depression and anxiety, sleep disturbance, and even substance abuse during these past couple of years. And it's for all the reasons you would expect. The length of time this is going on, the isolation, the uncertainty, I think compounded by the fact that what we have seen is that the understanding of COVID, it's a moving target, and they've been learning so much about it as we've been going on these last couple of years. So it appears as though for many people that the information we've been getting is inconsistent, when in fact this is a normal learning curve. As we learn more about the virus, the recommendations shift and they change. But it's very frustrating, and that lack of understanding of that and the uncertainty of the future just contributes to all the mental health stress that we feel.
Yeah, that uncertainty definitely does a number on us. All right, so Dr. Mendelsohn, let's talk about these impacts. I know he kind of gave a big picture of the impacts, but the impacts on children, if so, does it show up differently than it shows up in adults?
So certainly the COVID-19 pandemic has impacted all of us. It does seem to have had a slightly different impact on children than on adults. A 2021 meta-analysis that was actually conducted internationally found that children have been less impacted by social isolation as a result of COVID-19 because they've had family there the whole time, but they have been more vulnerable to the stress and the psychopathology of their parents. And unfortunately, this is especially the case for children in homes where abuse has been a factor. They've been just that much more vulnerable as the parents are more stressed out and there aren't as many people outside the family involved in the care of the child to bear witness to what's going on.
All right. So let's kind of talk about some suggestions. All right, so Dr. Gutterman, what suggestions do you have to help people who may be struggling emotionally while we are continuing to live with this?
Well, it is vitally important. Self-care is vitally important at a time like this. It's always important, but especially throughout this pandemic. So several things. First of all, take care of your body. That is something that's easily forgotten. So making sure you get sleep and create a regular schedule for that. Participate in regular physical activities as much as you can safely. Eat healthy. In addition to the chocolate that you get tonight, make sure you eat healthy. That junk food is not good for one's mental health. Avoiding alcohol and drugs in significant amounts, certainly. Limit screen time. It's a big one. We're all spending so much time on the screen that limit it, especially 30 to 45 minutes before bedtime, because that helps disrupt your sleep. And relax and recharge is important as well. So that's taking care of your body. Take care of your mind. Reduce those stress triggers whenever possible. Maintain a regular schedule for all of your activities throughout the day. Limit your exposure, with all due respect, to media, where depending upon what the media is, there's the potential for false information. Making sure you get good information from reliable sources is vitally important as well. Stay busy. Hobbies, reading, writing, games, cooking, all kinds of activities. Keeping yourself busy is really important, and maintaining positive thoughts. And third thing I would say is connect with others. We have figured out very creative ways to connect with others during this pandemic virtually. So virtual gatherings with friends. And as you know now, there are recommendations about how to gather in person safely, when to wear a mask, outside versus inside. So whenever possible, connect with others and do what you can to help others. Reach out to those who might be isolated or need some contact. Helping others also helps ourselves.
All right. So what about if we need help? And I'm going to specifically go to parents who need help, right? Because the struggles and the feelings, are kind of like bubbling up to the surface a lot. Dr. Mendelson, how do we keep that from making that rub off on our kids?
Yeah, it's so tricky. I think Dr. Gutterman made a good point a few minutes ago too. Parents have really been on the front line of trying to navigate the recommendations, and you kind of think a certain activity is okay, and then it seems like it's not, and it's just such a shifting playing field. So I think an important first step is just to acknowledge that this has gone on for a long time now, and this is hard. I'm a big believer in meditation, but I saw a quote online that I thought was funny and kind of stuck with me, that you can't meditate your way out of a 40-hour work week with no childcare. This has been, many parents have been just asked to do the impossible and are just doing their best right now. Where you can access all the social support that's available to you, so that you have adults that you can vent to, not your kids. That is really important. Taking advantage of what childcare options are available to you. If you have family members in the area that are able to help, so that you can have some time to perform some self-care, that can be really helpful. And certainly when those moments happen that you maybe aren't your best self around your kids, maybe you blow up a little, or you act really anxious, just to give yourself some grace and remember that those moments too can be an important teaching opportunity for kids to see what you do to calm yourself down. And if you don't have the wherewithal in the moment where you're kind of losing it, repair goes a really long way with kids, to come back afterward and say, I really don't like how I spoke to you a few minutes ago, but I've had a chance, I had a really big feeling. I've had a glass of water. I've had some deep breaths, and now I'm feeling a little better. Let's talk about it now.
Instead of ignoring it and passing it off, really meeting it head on, so that both of you can learn together and they can understand that it's okay to be stressed sometimes, and we all need to learn how to handle it. All right.